Welcome to another episode of What Did the Patient Say with Doctors Dana and Lauren Brindisi, sisters and owners of Carolina Functional Neurology Center. We are providing you answers to frequently asked questions and bringing you inside information from real conversations we have with patients on a daily basis. Our goal is to spread the truth on health and healing because we believe everyone deserves to know the answers.
Hi, everyone. Welcome back to another episode of What Did the Patient Say with myself, Dr. Lauren Brindisi, and I'm here with Dr. Bianca Miret. Today, we are talking about concussions and kids. We get a lot of questions from parents about what to expect, what symptoms to be looking for, what kind of treatment options are out there, and what are some other miscellaneous things that could be expected when it comes to kids and some of their other pre-existing conditions. So today we're going to touch a little bit on all of that. And please, if you have any other questions after this recording, let us know and we'll be happy to try to answer those in a future post. So thank you, Dr. Miret, for coming on and talking with me today. I want to start by getting the lay of the land when it comes to what parents should expect after their child has hit their head or maybe had a whiplash injury, had a sporting incident, and they're concerned that their child may have experienced a head injury.
Yeah. Morning. When obviously leading from a concussion and in the pediatric population, they don't typically articulate their symptoms as well. So some things for parents to keep their eye on, obviously, there is that 7 to 10 day grace period. So they definitely are feeling a little off or seeming a little different afterwards, and they are still seeming that way 7 to 10 days. This is when seeking some additional help is important. Obviously, on site from an injury, like at a sporting event and hit our head, we definitely want to seek medical attention to rule out anything else that can be happening in the moment, like an injury actually to like a physical injury to the head and brain. But some things to look out for kiddos would be anything from like sleep changes, energy changes. So if they're really dragging coming out of bed and that's not their typical thing in the morning, or they like really energized at night and that's not something that's very characteristic of them. At school, are they having trouble? Are you seeing grades start to dip? Are we seeing maybe the teachers? You can ask their teachers to kind of keep an eye on them from their focus and organization and compliancy with other kids and the teachers. Mood is a big one. So if we're starting to get a lot of mood swings through the day that are atypical for them, typically that'd be something to look out for. Anything from like hyperactivity, even lethargic kind of behavior. So really with these symptoms, they can be pretty broad. It affects people very differently, and that is still consistent with the pediatric population. So obviously the parents know their kids best, and I would say just look for those kinds of changes that are just definitely different from their normal presentation.
Yeah, so I think that's what's a little bit challenging when we're talking now. We've ruled out any acute life-threatening issues or injuries related to the head trauma itself. And we're falling into this post-concussive syndrome category where it's been 7 to 10 days. The child may or may not see some improvement in those initial symptoms that we see with head injuries, like nausea, fatigue, maybe headache, weakness. And then after that, it's like, what are those things that fall into this category that could be related to the head injury? And I think this is the most challenging part for parents, is their kid is developing, right? So things are changing all the time in terms of their behavior, and trying to sort through if changes occur after a head injury, could it be related? And I think the take home is, if you start seeing behavioral changes that are negatively affecting their life after a head injury, I would be strongly considering the fact that the head injury could be playing a role, because the brain is so complex and we're talking about a head trauma and an inflammatory response in a developing brain, it's important for these children to be evaluated. And the things we do in our office as functional neurologists is compare our patients to normative data. So what does optimal actually look like? How do we make sure after a head trauma, especially in a developing brain, that we are making sure that they're still on track and that they're meeting their milestones?
Yeah.
So we have a lot of questions, Dr. Miret, about what are the treatment options that are out there. People hear a lot that they should just rest and relax, maybe take some anti-inflammatories, ice their head. Is there more that we can do?
Yes. The thought that after a concussion, we need to lay in a dark room, rest on those, all of those things have actually been shown not very productive for post-concussive syndrome. And there is a lot of studies that have come out, you know, in the last several years that demonstrate, obviously this is varying case to case, but after the head injury, slowly integrating some aerobic exercises, and this is definitely more of on a study, but what they did with these individuals is put them on a treadmill and walk. So in a very controlled setting in terms of light and air conditioning and all of those good things, but they had these individuals walk and they would go pretty easily, pretty slow on the treadmill. And as they would walk until they started approaching their symptoms. And as soon as they did, they would discontinue and they would take note of what time frame did that happen at and maintain that. So if it was like 5 minutes, they would stay at 5 minutes for a period of time and then see that they could handle more and more each time they went on the treadmill. And so this just shows that movement, and especially like a light aerobic movement, like walking, is actually really beneficial because it provides early stimulation to the brain and healing. It helps with lymphatic, it helps with anti-inflammation, helps with all of those things. So that way, after a concussion, laying in that dark room doesn't really help on those fronts. It just kind of actually shuts down a lot of stimulation to the brain and it struggles to heal. And the walking allows some gentle stimulation, helps with reducing inflammation. Obviously, blood flow will be getting to the brain better. And so your brain needs stimulation, oxygen, and glucose in order to heal and to change. And so walking helps with that. So the thought of laying in a dark room is not really what we should be doing. This is something that can be done as soon as after the concussion, but obviously when they arrive in our office, there is a lot we can do from a treatment standpoint. There's tons.
I would agree. And I think that's where when some generic aspects of concussion rehabilitation are not quite cutting it, seeking attention from a provider who is well-trained and well-versed in localizing where the problem is. That's the toughest part of concussions in general, they're all different. I mean, concussions are like snowflakes, right? Every single one is different. The area of the brain that can be affected is different. Integrative state of somebody's nervous system. What other pre-existing conditions do they have? Are they experiencing other inflammatory processes already? Do they have a history of another head injury? There's a lot of complicating factors. So when it gets challenging to navigate on your own and you see after those 7 to 10 days that your child is not making a full recovery, it's helpful to work with somebody because there's very individual treatment that we can do on top of some of these generic suggestions that can be really individualized for each patient's needs.
That's really important, is that threshold. That is something I see a lot of when people go through concussion treatments before they kind of arrive to our office. And they always say, like, I feel terrible, absolutely terrible after my treatments. Not from us, but like they'll say, like, I've done this concussion protocol, I did this, and I kind of say you get blown out of the water from your threshold. And that's something that you just touched on, is really knowing that threshold is so important for concussion management and healing.
Yes, and that stems from the changes that happen with the autonomic nervous system when somebody's had a concussion, and that can be variable per person. So just like Dr. Miret touched on about getting up and doing some very mild aerobic exercise, that's a general recommendation that may not be suitable for everybody, depending on what those needs are. We have a lot of patients that we have to start treatment with them lying down, because just being up against gravity can be very challenging. And then we have other people who are just presenting with very, very mild autonomic changes, and we can jump right into more complex, upright cognitive tasks. So the spectrum is very wide depending on what's actually going on with the patient. So next, we got a lot of questions about different pre-existing conditions, other aspects of somebody's physiology, maybe changing, like digestion, something you wouldn't think would be related to the brain. I want to touch on how does a concussion maybe affect other types of inflammatory disorders, other issues like digestive function. How do those two tie in together?
Yeah. The gut and the brain are a two-way street, and the way that they connect together is through our vagal nerve, which is the nerve that wanders through the abdominal cavity and thoracic cavity. And really what we thought was this nerve was mostly motor, right? The brain was controlling most of what was going down into the stomach and into the digestive system. And what we actually know is that it's actually primarily sensory than motor. So your gut has a huge role with your brain function, as well as the brain going down to the gut. And when there's been a ton of studies that show that immediately following an injury, a head injury. So the study that I'm thinking of, it was in mice. So they split the mice into two groups, one group that had concussions and one that didn't. And the one that didn't, they swabbed the microbiome, and the one that did, they swabbed the microbiome about 5 to 10 minutes after the concussion. And the microbiome was significantly different. A lot of overgrowth, low good commensal bacteria, low good bacteria, high bacteria that we don't want there. And this was within 5 to 10 minutes after a concussion. And so it just kind of explains how important our gut health and our brain are, but also the head injury and how that changes someone's gut biome and microbiome and gut function from that. And that's just one example that can happen after a concussion. But also what I talk to my patients about is we want to talk about what happened before the concussion. What was our kind of nervous system state? What was our sleep like? What was our energy like? What was our digestive system like before the head hit? So going into that scenario, what was our life like, right? That sets us up very differently for what happens after as well.
Yeah, definitely. I think that's important. And there's definitely more studies coming out. That's obviously challenging to test, right? Have somebody have digestive issues or prior to a head injury, and what does it actually look like after? But something that doesn't necessarily apply to children, but there are definitely more studies coming out about women and how when on your cycle you actually get a head injury. And I think that's a very interesting kind of parallel take home to say that the state of aspects of your endocrine system actually play a role in the susceptibility of the severity of the concussion itself. And I think that can be extrapolated a little bit when we're talking about other changes physiologically that might be hindering our ability to heal and repair. And one of those, I think, hopefully there'll be more studies on this in the future, but talking about other inflammatory conditions that people already have, because a concussion really is an inflammatory process that happens. And if inflammation is already high, we're just accelerating that. And we can certainly see people who have other underlying autoimmune conditions, things like that, that can be worsened after they've had a head injury. Anything else you want to touch on, Dr. Miret?
I think the big take home for this for parents is head injuries are significant. I would say the thought of you need to hit your head to have a concussion, not the case. Concussions are not diagnosable on imaging. There are no blood tests or images that can diagnose a concussion at this time. And that is something that I don't know if you come across Dr. Lauren, but I have seen a lot of situations where people say, well, the ER said I don't have a concussion. And it's actually very, very evident that this person is struggling with post-concussive syndrome. And it says like, well, my MRI and CT were clear. And it's like, a concussion is a metabolic injury to the brain. It's not something that can be seen on an image. So take home for parents to know that and not just kind of write off that diagnosis right off the bat. And obviously keep a watchful eye on their kiddo as they're, integrating it back into school and integrating into their sports that they love to do, that looking out for maybe those less noticeable symptoms than opposed to like nausea, vomiting, headaches that we typically think with concussions, but hyperactivity, weird energy kind of presentations during the day when they shouldn't be energized or when they are energized or when they should be, restful and they're hyper, vice versa, digestive problems, stuff of that nature, just kind of more of those less noticeable symptoms to just keep taking note and knowing that there's help out there. There are people who know how to handle concussions and help heal. And then you and I were speaking about, having a collective team for that.
Yeah, I think that's another one is if you are seeking treatment and you're not quite getting the results that you are looking for, being open and honest with your provider about the limitations that you're reaching with the treatment and understanding that this can take a team of people to actually help because there can be a multitude of things going on and concussions are complicated and that's okay. And that's where forming a good relationship with a knowledgeable provider and again, being open, honest with them about how the progress is going and what you're experiencing. We co-manage with providers across disciplines on a regular basis with our patients because we certainly don't know everything. And it's about getting patients and yielding the best results for people.
Yeah. And threshold. I would think that's one of the biggest things I also see with concussions. And I know we just touched on that for parents is not pushing past their metabolic threshold. And this looks so different for everyone. If they have an underlying autoinflammatory problem, do they have any other things that are contributing to their symptoms, but maintaining under their threshold. And I know we spoke about that through some of our videos this month on social media, but frequency of stimulation is more important than intensity, through those healing stages and addressing all those factors. So that way someone's threshold is going up. And we're not just going past it each time. So those are a lot of things that I end up seeing in my practice is a lot of concussion patients feel terrible after their treatment, like from other things they've tried. And so they're very nervous when they come, and do our consults or come in for their new patient exam. And they're like, am I going to feel terrible after this? Is it going to get worse before it gets better? And I was saying it shouldn't. It should just be steadily getting better. There's going to be ups and downs, but it should just be this gentle kind of not directly linear, but kind of moving in this upward trajectory of you feeling better. It shouldn't be, worse and then better. And I think that's also an important take home if you're seeing your kiddo go through like post-concussive rehab.
Great. Yeah, that's a great place for us to end. If you guys have any other questions, if there's any other topics you want us to talk about, please let us know. You guys and the patients in our office are the ones that are fueling the things that we're discussing on here. So please share, subscribe, all the things. Let people know that this information is out there and we are here to help. So thank you, Dr. Miret, for being on, and we will talk to you again soon.